Hafide, and welcome to the Guam Homeland Security Office of Civil Defense. I'd like to welcome you to our press conference on the dengue virus and the status update for that. Again, at our table you can see here our Honorable Magahaga, Governor Lilian Guerrero. We also have with her on her left, Linda Unpingco-Denorcy, the Director of the Department of Public Health and Social Services. On her left, we have Dr. Thane Hancock. He's a CDC medical epidemiologist. On his left, we have Tom Nadeau from Environmental Health. And on his left, we have John Fernandez from the Department of Education. Moving down the line, we have a very familiar face from Guerrero, our mayor, Melissa Tavares. We also have Homeland Security Advisor Tim Uggan, and Charles Estevez, Civil Defense Administrator, and Walter Leon Guerrero from the Guam Environmental Protection Agency. We're going to go ahead and get started just with handing over the microphone to our governor for her remarks.
Thank you very much, and good afternoon to everyone. This press conference is to provide information to the community on how we, as public health and the government, is responding to the two local cases of dengue fever. The first local case was discovered on September 11th, and at that very onset of the discovery, the Department of Public Health and Social Service implemented their immediate command control response, which is a protocol that they have established with best practices, with scientific documentation of its ability to help contain and prevent further spread of dengue fever. And the next day or the following day, I instituted an emergency declaration, because as a result of that, we're able then to move resources quickly to support the Department of Public Health and Social Services. And I know Linda's going to go into more details, but I just wanted to assure the people of Guam that what we're doing is the right way in identifying and addressing the dengue fever. The recent director of World Health Organization visited Guam and went through the protocol and the standards of public health implementation, and he is very complimentary. He said that he was impressed with the way we are handling, which is even more confidence and credibility to the work that we're doing to help prevent the spread of dengue fever. I just want to say dengue fever is not really a unique situation in Guam. If you look in literature, you'll see that dengue fever is endemic to many countries, including the United States, the African countries, the Mediterranean, of course, Western Pacific, and recently I understand that the state of Hawaii had 200 cases in 2015, and today it's 0. So I point that out to assure the public that this is a situation that we can control and we can eliminate. We need all your support. We need all the community's involvement. We need everybody to really understand and really be accurately informed. I know that there is fear out there with the dengue fever, but I think the more knowledge and information that we provide to the community, that can be allayed. So I just wanted to also say that as a result of the second case, we've instituted more resources, and now we have, through Homeland Security, by the Homeland Security Advisor, we have established the Emergency Command Center, where we are now going to have all the department agencies and all the stakeholders in one area where we can all communicate very closely. We can all share resources very quickly. And again, that is a way again to address and to attack and to work very hard to eliminate this situation. I also want to say that we have medical professionals, we have investigative people, we have environmental people. The mayor is, Mayor Melissa, who's the president of the Mayor's Council, is very on top of it. We have plans to clean up areas where there are tires, where there are stagnant waters, where there is garbage. And so all those prevention and all those quick actions, I think, just makes for our community to, again, control and contain dengue fever. So my partners up here are here to answer questions and to also provide you with information of further details of what we're doing. Thank you very much.
And now to our Director for the Department of Public Health and Social Services, Linda Unpingco-Denorcy.
Yes, on our first case, it was in Manila, and we identified it to be a 12-year-old male Filipino. The transmission, as we mentioned, is a local case. It wasn't from an imported case. And so we mobilized immediately our incident command system. We activated our arboviral response plan. The minute we have one local case, that triggered the plan to be activated. And in doing so, we activated our incident command system within the Department of Public Health and Social Services, following the structure of how we're gonna do this. And we have the operations team. We have two operations entity, one being the environmental health with Tom Ledoux as the head of that operations chief. And we also have the medical component, and that is with Dr. Susan Kaneshiro, where we have the two teams of the ECHO team that provides education about the dengue virus, and we also have them assess the home and instruct them of all the information that they're going to need, and the epidemiology team that is comprised of our epidemiologists who will then assess any individual and that family that we identified of that 12-year-old. The minute we found out that the child was infected, we immediately launched all measures to secure the perimeters and identify 200 meters around the area where the individual has been affected. We identified about 83 homes. Now we found out that it's gone up to 90 because they have extended homes. And we went and we launched all our teams to go out there and start the education and also more testing. And so that has been ongoing, and it's continually ongoing as we speak. And then just recently, yesterday, we identified another case, and that was in Dedido. And so that was an adult that lives in the Swamp Road. And again, we did the same thing. We mobilized our environmental health staff to go down there. And while this is all happening, we also worked, going back to the Manilo case, we wanted to ensure the complete safety. Vector control is very critical to contain the virus through the mosquitoes being killed. And so what we had done was we sprayed with insecticide the inside and outside of the Agueda Johnson School where the patient goes to school. We wanted to take measures to ensure that this high-risk area was properly contained and controlled with the vector being killed through the insecticide. We then launched the following day to continue operations in spraying the insecticide also to the Orda Chalampago School. And so I'm happy to say that has been completed as of today. Moving on, we are going to continue all efforts at both sides. We've mobilized the team, as the governor has indicated. We have actually activated our Homeland Security with Tim on the forefront there. And so we will continue to have our incident command system in place, continually mobilizing all our staff. Well, we want to tell the public that this is a disease that is spread not communicably, not from one person to another, but from a vector, from a mosquito that bites an infected person and then transmits the infection or the virus to another individual by that mosquito biting the other individual. So quarantine is not needed, and we also want to make certain that everyone understands that having just the vector control is not gonna solve the whole problem. We need to clear up breeding sites to ensure that everything is completely free of the mosquitoes continually to breed and multiply. And so that's why we're doing a lot of containment and control with the vector as we move along. Now, there will be cases that will be coming forward. We anticipate that to happen, as the governor had indicated earlier. And we also have our experts. Dr. Thane Hancock from CDC has been with us throughout the whole process. And of course, we continue to have support from the US CDC, our partners. We just had a conversation with them this morning, and we are asking for also assistance for entomology and also insecticide and epidemiology. And this is in the event that this disease may be at heightened even further, so that there are more cases. We're just taking lots of precautionary measure. We've activated and mobilized a lot of our resources within the government of Guam, thanks to the support of our governor. And she has been very supportive of all our efforts. We're mobilizing a lot of the police and the Department of Agriculture, and also all the nurses and every entity that we can think of to get this cleanup done immediately in the swamp area, like the Department of Public Works, who's key players. And so we just want to assure and that the public knows we are doing everything to control this vector so that it doesn't continue to infect our community. Thank you.
Now I'd like to open the floor for questions.
Is the government of Guam aware of any other suspected cases of dengue pending laboratory confirmation?
Right now, our team is still moving out there, and so we're launching more patients that are being screened. So we're just anticipating 2 more testing at this point in time.
So there are at least 2 more suspected?
There may be. We will find out by today. We just identified that today.
Okay, and now with these suspected cases, are you saying that the government of Guam is not considering quarantine to prevent the mosquitoes from biting these suspected cases
No.
or confirmed cases
No.
either?
No,
Is there a reason?
it's not
for that?
it's not a communicable disease like TB, where that is a disease that would be spread. It is not, and quarantine is not going to happen, and it's not an issue. And I can also divert to Dr. Thane Hancock, who will give you the more detail as far as from the medical side.
Yes, please, if you could just explain how it's not possible that if the patient's not in quarantine, that the mosquito would then bite the patient and then transmit it to another person.
Yeah, so I think there might be a little confusion in regards to what quarantine is versus isolation. So for patients that do have symptoms of dengue, we do want to keep them from being bitten from mosquitoes. So we encourage all patients to avoid mosquito bites. And in fact, that's something we're encouraging our entire community, is to avoid mosquito bites at this time. Because you're right, if a mosquito bites someone who's infected with dengue, then that mosquito will pick it up. That's how it spreads. So we really do encourage those people with symptoms of dengue to self-isolate. And isolate is a term for when someone has symptoms of an illness and you're trying to prevent that transmission. Quarantine is when you're actually taking people who don't have symptoms and putting them away and monitoring them to see if they eventually develop symptoms, which is not something done for dengue. But we would want to encourage people with symptoms to isolate themselves from mosquito bites. And again, going back to the message that Director and Governor brought up, really in this outbreak, the way that, or these 2 cases, a way to really limit transmission and prevent it from becoming a big outbreak is by our community working to prevent mosquito bites on themselves. And that's by wearing repellent, wearing long clothing, avoiding areas with lots of mosquitoes, and also doing their work around their homes to clean up those items that can catch water and be mosquito breeding sites, and reducing the number of mosquitoes.
So then will the government be isolating any of the suspected patients?
So for the isolation, as Director Denorcy mentioned, with some diseases and illnesses, depending how it's spread, isolation requires a higher level. So if it's a disease that requires or that may spread through airborne, then you need to isolate them in special rooms that the air is filtered. But for mosquito-borne, it's really just avoiding the mosquito. And so generally it's just asking the patients to avoid mosquito bites. Obviously for patients that are in the hospital, there's extra precautions to make sure that there's no mosquitoes biting them.
Wouldn't you say the mosquitoes are kind of airborne? It's a little difficult to avoid a mosquito.
Airborne transmission involves actually molecules, the infection getting in molecules in the air that can stay around for a while and you can breathe in. Mosquito-borne or vector-borne illnesses, of course, from the bite of a mosquito. And so that avoidance can be done with repellent, long sleeves. Airborne transmission, you require additional filters, special masks, that sort of thing. So vector-borne and airborne are different.
Understanding the difference between quarantine and isolation, I understand that people can be asymptomatic as well. And what is the likelihood overall of mortality, considering that you don't actively isolate these people?
So again, for people who are ill and have the symptoms of dengue, it's standard, like I said, that we want them to avoid mosquito bites.
Right.
And again, as far as mortality, in dengue outbreaks, the important thing is that avoiding severe dengue, which some people can have, and we talked about some of the symptoms of severe dengue that people should be aware of if they have high fever and they're getting severe abdominal pain, persistent vomiting, bleeding. Those are all reasons to present to your provider as soon as possible or emergency room to get care. And that's really going to help limit mortality, because with appropriate management, people survive dengue. And so really presenting early if you have those symptoms of severe dengue is important.
So to also kind of go to his point, one more question, I apologize. When he says it's airborne, I think we kind of understand what he means when he says that, and it is a concern because there are a lot of mosquitoes. So what is the importance of that 200-meter radius? Does that have to do with the lifespan of the mosquito and its ability to spread the virus?
Thank you. So we have established 200-meter radius based on the flight distance of the mosquito. It's been determined that around 150 to 200 meters would be the ideal area of surveillance based on the location of the patient. So that's how the 200-meter radius was determined, based on the flight of mosquitoes.
Is there a possibility that these mosquitoes carrying the dengue infection are now in every village of the island?
Well, the Division of Environmental Health, we've been conducting surveillance throughout the island since last year. Our program was revived in 2017, and since then, we've been building the foundation of the program with the establishment of the Guam Environmental Public Health Lab, otherwise known as the Mosquito Lab. And since then, we focused on different areas of the island, which may act as a sentinel location, like an early warning system, if you will. So those areas have been identified. We do daily trapping, collection, and identification. So we've been monitoring the situation in terms of mosquito species and density since last year. So to date, there's nothing unusual that we find in our capture. We're finding Aedes albopictus, which has been around for years on island. They're not an efficient carrier of dengue virus. Recently, we've been able to test mosquitoes that we capture for presence of the dengue virus. To date, all of our screening tests has been negative for dengue virus. So at this time, based on just our surveillance and the mosquitoes that we've captured, nothing unusual has been identified.
Except for the two patients.
In terms of the patients, yes, it's been locally acquired. So apparently there is a infected mosquito, or was an infected mosquito, that had caused the transmission from them.
So just to clarify then, outside of Manila or the Champago and Guerrero, is there a risk of infection for dengue?
Well, there's always a risk in the sense that we have two different locations on the island. One is in central, one is in northern. Now, that's part of the surveillance, and it's part of our monitoring by the medical staff as well. We respond based on the results that we get from the hospitals, if you will, and also our surveillance. So that'll be a difficult answer to the question to answer is whether there are mosquitoes that's infected throughout the entire island. What we're doing is trying to contain known infections, and that's the two locations.
I think those two questions are alluding to this point that I think I was gathering from your responses. Can the dengue virus naturally occur in the vector, or did the vector have to get it from previously existing, somebody who came from an area with the dengue virus and perhaps was not showing symptoms, or they just never went and got checked in the hospital? does it naturally occur in the mosquito, or did the mosquito have to get it from a human first to transmit it to somebody else?
Yeah, so dengue virus needs to be picked up. The mosquito needs to pick it up from someone that has a dengue infection and has the virus in their blood. And then once the mosquito picks it up, then after a few days, it can start transmitting the virus when it bites other people. And so, as Tom mentioned, it's hard to really identify where exactly in Guam the infected mosquitoes are. And that's why we're really encouraging the public to really take, to think that any mosquito bite on Guam is putting you at risk for dengue. And so that you really should do all that you can to avoid mosquito bites. Again, wearing the repellent, long sleeves, that sort of thing. And also trying to limit the number of mosquitoes on Guam by cleaning up those small containers that can catch water and that can breathe and that sort of thing. So really, I think these questions are good ones about, hey, what is the risk? And right now for Guam, I think all of us should try to avoid mosquito bites and do what we can to reduce the number of mosquitoes in our community.
Governor, is Guam Memorial Hospital going to be able to accept more patients who walk in wanting to be screened for mosquitoes?
Yeah, Lillian has gotten her staff also prepared. As you know, that the 2 cases that were identified did come through the emergency room. So she's also preparing for her area, to better take care and screen these patients. Also, I want people to know that public health is also sending out trainers to talk to clinicians in the private sector, private clinics, because we want them to also to be able to catch these symptoms and test for it. So every clinic, every healthcare facility should really be up to speed with identification of dengue fever.
How many households in Swamp Road have been identified as being in the high-risk area?
There are 18 homes at this time in the swamp area.
Was there any sort of connection between the 2 patients that were identified?
No.
Was the Swamp Road patient the worker at Untitled Elementary School?
No.
So along Swamp Road and Guerrero in general, there are some individuals living in substandard housing?
Yes,
near
that
the
is
jungle
correct.
area.
Yes.
What is being done to assist these individuals?
Very good question. We're right now launching our team, as I mentioned, and we're also cleaning up that whole area because there are breeding grounds, breeding sites for the mosquitoes. We've already collaborated with Mayor Savaras, and also the government of Guam agencies are getting involved to assist, such as the Department of Public Works and also EPA and any other support she needs. We also activated the Department of Agriculture to make certain, and the Guam Police Department, so that there's safety for our staff to go out there and continue their assessment of all the 18 homes.
Will you be providing supplies or?
Yes, absolutely. For example, Public Works is providing some dump trucks to help Mayor to move that, and also we have, we're moving all the tires out. Mayor, you want to talk about?
This morning, the Guerrero Mayor's crew actually started removing tires. We met with the residents. We removed all the tires from their properties as well as white goods, and we're gathering whatever trash that they had settling around the property, trying to help them, assist them with the removal of those things. We are working closely with DPW and Guam EPA as well.
Do infected mosquitoes pass the virus onto their offspring when they, so the mosquito lifespan is how many weeks? Like the
So great question. And something that folks have been looking at. Mosquitoes will have to pick it up from an infected patient, and generally the mosquitoes that carry the dengue virus will live for about a month in the wild. So, and unfortunately, they can continue to transmit the virus throughout their life until they die. So it's about a month that they can transmit.
So best case scenario, like if we all stay indoors or follow whatever policies, then after a month, we're hoping that the virus eradicates itself out of it.
Well, certainly if we're avoiding mosquito bites, we're looking at, So there's a couple things. One, right now, sure, we're at high risk and we want to avoid mosquito bites. But also, and I think Guam has realized this before and why they prepared for this moment, is that we're at constant risk of reintroduction, right? Because of dengue outbreaks around the world. And there's always a risk here in Guam. And so I think sort of not only these current efforts to avoid mosquito bites, but also thinking about long-term efforts to also reduce mosquito bites and avoid mosquito bites is important.
Governor, are we seeing a drop in tourist or travel reservations to Guam, and is GVB on top of any mitigation plans to avoid?
I haven't heard anything as a drop of. That's always a risk, as you know. Japanese tourists are very sensitive. You know, when we have the bird flu situation, they stopped traveling, or they decreased their frequency of travel. So right now, I do not know of numbers decreasing because of this.
Yeah, and I also want to emphasize that dengue is global. It is a global, and it's occurring everywhere, even in Hawaii. So, you know, Hawaii has a lot of tourism. It's a very wonderful destination for a lot of them. So it is continuously ongoing. So it is global.
It's not happening in Saipan, though, right?
Yes, it is.
It is?
There are cases in Saipan. There are cases in RMI, Yap, Palau, the Philippines, and as you know, there's frequent travels from those places. And again, I think the most assuring is understand about what we need to do to prevent it with and how it is transmitted.
Superintendent Fernandez, is anything being done within GDOE for the schools to I guess, implement like preventative measures or increase awareness about the issue?
So we're very, first of all, I want to thank the governor for standing up the EOC this morning and being able to pull all of us together, because I think what's really critical for our stakeholders in the education system is really information. I think a lot of the things that we get from parents and teachers, employees, is just trying to find out more. And so we're all on that learning curve, trying to make sure we are up to speed on the latest developments, as well as information about dengue fever. So following the guidance that's been given to everybody, we've also taken those measures at the schools to make sure that we're also looking at water catchments, any areas of ponding that we can try to mitigate, to try to just take those general preventive measures at all of our schools. And then second, I think we talked about it this morning, we started to put out information. I believe there are, so we have posters that were provided by Public Health yesterday to provide at all our schools. But my request was also to continue that flow of information, to be able to deliver information that can go to our employees, our parents, and our kids, so they can understand what we're talking about, because we don't need to wait for the next particular issue at school to take place. We wanted to use this as an opportunity to educate all of our stakeholders so that they can understand what's happening, and in the event that we need to address anything at school, they'll be better informed. So I think that discussion is ongoing. I know that public health is also being able to get resources from CDC to be able to help us with that effort. So we want to use this opportunity to educate our community. We got 30,000 students and their families and 4,000 employees. The more information's out there, the better. I hope that our stakeholders and the broader community can protect ourselves and take all the preventative measures that are needed to get through this situation.
Why is this only happening tomorrow when the government is known to attend?
What's happening?
Why is the information only being sent out to students and the parents tomorrow?
I'll turn it over. We did provide information, as we received it over the last couple of days. But we're looking also for more kid-friendly posters, educational materials that can be used not just for the parents, but also in the classroom. So we know that everybody's interested in this issue. We want to use this opportunity to actually, do more education as we go along, knowing that, we might be in this for a few weeks.
Yes, and the department has been issuing press releases, giving information as far as cleaning debris all around, how to dress, about the off, all the repellents. So it hasn't just been recently. We've been sending out press release after press release, letting them know about imported cases, about local cases. And so I want to touch upon Dr. John Fernandez's point. We are also communicating with our federal U.S. CDC partners, and we've asked for entomology support, and we've already gotten approval for doing genotyping in regards to having our mosquitoes, if we identify virus in our mosquitoes, to be sent off island, and for them to analyze the virus and compare the virus that's in the mosquito with the virus that is from the human sample. And also we can compare the virus that our population has of our mosquitoes compared to the other population of the mosquitoes around the other islands. And so we've gotten that approval, and Dr. Thane and I are working on also, what we did was we discussed epidemiology support should this thing continue, and of course risk communication so that we can get more information out there that are frequently asked questions and other educational concerns for high-risk incidences and so forth. And so we've gotten that support, and we're also going to communicate continuously with our federal partners to get that.
I have one last question. Knowing that dengue is global, knowing that Guam is constantly a threat with Philippines, Palau, and other areas where our people frequently visit, has dengue, we've been blessed for many decades now to have it not naturally occurring or locally occurring in Guam. I think perhaps the people may have been taking their responsibility for granted because the government can only react to cases that are confirmed. So could you please explain the importance of the community being extremely aware of what's going on, their responsibility in helping the government to contain this issue?
Absolutely, that's a very good question, Julius. We have emphasized that the vector control is one aspect, and we are confining it to where those cases of the patients that have been infected. But that's not enough by itself. The key here is to do prevention through eliminating all these breeding sites for these mosquitoes, and that is the message we're trying to get out there. And if you feel sick, please see your provider. Informing the providers, please, if their patient is ill and has all the symptoms of dengue, have them tested. And so then we can come in and do more contact surveillance and follow-up. So that's the message we want the media to help us with.
The speakers put out a release expressing some concerns about the price of insect repellent. Is there any confirmed cases of price gouging at this point?
No. Price gouging? Not to my knowledge.
And this is anecdotal, but there are some stores in the north that have run out of particularly the spray type of mosquito repellent. Is there any concern with the availability of supplies?
The off, you mean those repellents?
That's right, yeah.
You know, that could be a possibility. I know that there are other retail stores throughout the island that still have those supplies.
When did the news release first come out about the confirmed dengue case? The first one?
Yes, the first was September 11, 9/11, of all times, huh?
Yeah.
Yeah.
So that was when
That
the
was,
received the
yes,
notification.
that triggered the Department of Public Health to activate its arboviral response plan. And so once we got that, we mobilized quickly.
And the news release went out on the same day?
Yes, we got all the news release, and we've been on top, and we've been notifying everyone in the community. I've been having tons of interviews with my staff on the media and also with the governor's communications department.
Are other animals, are they susceptible to the disease, like
No.
a stray animal population?
No,
Can
we
people
confirmed
spread
that.
it?
That's a frequently asked question. We confirmed that with Dr. Pohl. And no, it is not transmitted through the mosquito from the animal, such as a dog, to another animal.
Or I mean, but like a dog can't have the virus and the mosquito rebite the dog and
No.
transfer it.
Are there any sort of vaccines for dengue?
Yeah, well, Dr. Thane, I'm gonna have you
Okay.
answer that.
Yeah, it's a good question. We've been, public health in general has been trying to work on getting a dengue vaccine for years. And recently there was a dengue vaccine that was developed and initially rolled out. Unfortunately, in the rollout of the dengue vaccine in some areas such as Philippines, there were some issues. And because of that, the U.S. is still evaluating whether or not it's appropriate for use in the United States and places like Guam. So there's not been a statement yet from the ACIP on the dengue vaccine. The WHO recommendations say that it should be used in places where there's a high level of endemic dengue, so that there's a lot of transmission of dengue, because they find that if you haven't had dengue and you get the vaccine, there can be issues. So that's why the dengue vaccine is not available in Guam, and also would not be helpful for Guam.
Didn't the FDA approve the vaccine on May 2nd, 2019?
So it is FDA approved, but with all vaccines, when they're rolled out, there's monitoring of how it goes. And because of that, there's still some deliberation on at least for the U.S., whether or not it should be licensed to be used in the U.S.
Governor, the CDC has issued an outbreak alert for Guam. Are you concerned that this will have a negative impact on our economy?
You know, like any emergency situations, news like that, of course, there's always a concern, and GVB's monitoring it very closely. You're talking about tourism industry impact.
For the most part,
Yeah, and so of course we're monitoring that very closely.
Thank you so much. That ends this press conference. I know you all have deadlines. And the Joint Information Center will be issuing another press release later today. Thank you so much.